again, ladies and gentlemen. This will be a talk on hypothesis testing, and in this talk we have some very important information that is high yield for USMLE biostatistics, and so I hope you do pay attention. We do have a little bit of information that's pretty low yield, but even for the low yield stuff, when I talk about low yield stuff, it is important to know some of the basics, at least know this stuff superficially, so that if it does come up on the test, you'll at least have the ability to make an educated guess. If you haven't had the opportunity yet, please consider subscribing to my Patreon page at www.patreon.com/pwbmd. You can get there by clicking the link below in the description of the video or on the I button on the upper right hand corner, and it will link you up. If you consider chipping in $1 a month, a little bit goes a long way to help keep these videos free. And as a bonus, if you subscribe, you'll have access to some of my premium videos in which I go over case studies, formulating differential diagnosis, how to put together a treatment plan, things that will come in handy for you, especially for step 3 clinical case scenarios and for general practice. If you're a medical student or a resident, it's really good to have a systematic way of going about those things. Attendings just eat that stuff up. So I think that these videos will be useful for you. Thank you very much in advance for your consideration. I really appreciate it. So as I said, we're going to go over some basic definitions. Very high yield, we'll talk about statistical significance, very high yield, not really a lot of calculations there. So that's more of the high yield stuff. And then we'll talk about some of the calculations, how to determine the p-value. This is not as high yield because it does require the use of statistical tables, which is not part of the standard material they give you, like your CVC values and regular range of sodium and all that stuff. So they would have to give you the table on a question, and I just don't see them doing that. But it is good to kind of know how it's done because it will help hammer in what p-values are, and we've kind of alluded to it earlier. And then we'll do an example, and that will help kind of tie all this stuff up and put a bow on it. All right, so in hypothesis testing, we're always questioning between a null hypothesis and an alternative hypothesis. Well, what does that mean? What is a null hypothesis? Well, your null hypothesis is simply a default position. It's kind of the pessimist in the room. It's the one saying that there's no difference. There's no difference between the test population or experimental population and the population at large or control population. So let's say you're testing a blood pressure medication, and you want to know, does this blood pressure medication lower blood pressure? Now, you can't just give it to one person and see a decrease in their blood pressure and say, yep, it does. You have to do more than that. So really, the null hypothesis is that there's no difference. So when you administer the blood pressure medication to an experimental population, and when you administer placebo to a similar control population, your null hypothesis would be that it doesn't change blood pressure. Or maybe you're testing for whether it improves survival, and your null hypothesis would be that it does not improve survival. So it's the default position. It doesn't work. Now, you can reject or fail to reject a null hypothesis, but you can't prove a null hypothesis. Why is that? Well, that's because the null hypothesis is really the negative, and you can't prove a negative. At least it would be incredibly difficult. So let me give you an example. Down the road from my house, I have there's a lake down the road from my house. I live in Minnesota. We have tens of thousands of lakes here. And if you were to go to this lake and I were to tell you, prove to me that there's no fish in this lake, how hard do you think that would be? It would be really hard. You could go fishing on the lake, you could go scuba diving in the lake, but there's always the possibility that maybe the fish are sleeping. I don't know, do fish sleep underground? I don't know how they sleep, but the fish may be hiding from you, or the fish may go around you. But it would be really hard to prove that there isn't anything there, because you'd have to be everywhere at once, and that would be really hard to do. So you really can't prove the null hypothesis. Now, on the other hand, let's say I were to ask you, prove to me that a fish is there. Well, that wouldn't be as difficult. All you need to do is take your fishing rod, go into the lake, you catch a fish, and you can reasonably conclude that you've proven that a fish was in that lake. And that would be the alternative hypothesis. The alternative hypothesis is the positive. It's the position that there is a significant difference between the test population and the population at large. And I say test population and population at large because that's typically how it applies to biostatistics. But the null hypothesis and alternative hypothesis, they have applications outside of biostatistics. So this is really just definitions that really apply to our purposes in biostatistics. The null hypothesis you'll often see abbreviated as H naught or H sub 0. The alternative hypothesis, you may see it abbreviated as H sub 1 or H sub A. Okay, so what about a type 1 error? What is that? So a type 1 error is when we reject the null hypothesis, essentially accepting the alternative hypothesis, when the null hypothesis was true all along. So when you reject the null hypothesis, you're seeing a difference. You're seeing something. And if the null hypothesis were true all along, well, that thing that you were seeing was not actually there. So you can think of a type 1 error as seeing something that's not there. In the legal system, the null hypothesis is that the person is not guilty. Remember, we're innocent until proven guilty. So it's not up to the defense to prove that a person is not guilty. It's up to the prosecutor to prove that a person is guilty. So in other words, and I think actually if you go into complex law, at least in the common law system like we have here in the US, you have to provide evidence that a person is guilty, or at least enough evidence that a reasonable jury would conclude that a person is not innocent. So essentially, you're persuading the jury to reject the null hypothesis that the person is not guilty. And I think that's actually how the law works at the more complex level, but I'm not a lawyer. So that's what a type 1 error is. You would be finding a person guilty, rejecting the null hypothesis, when the person didn't commit the crime in reality, and that would be a true null hypothesis. So the probability of rejecting the null hypothesis when the null hypothesis is true, or the probability of a type 1 error, is equivalent to the value of alpha. And remember, alpha is a value that's given in a percentage or a decimal less than 1, and that is, we've seen, the significance level. We already talked about that. And this can be considered a false positive rate, because that's really what it is. When you find a person guilty who didn't commit the crime, that was a false positive in the law. Or let's say that you have a screening test, and that screening test was HIV positive, when in fact the person was HIV negative. We call that a false positive. So the value of alpha, or your type 1 error rate, is really your false positive rate. The type 2 error is the exact opposite. So it's failing to reject the null hypothesis when the null hypothesis was in fact false. So don't think of failing to reject the null hypothesis as accepting the null hypothesis, but when you fail to reject the null hypothesis, basically what you're doing is that you're not seeing something. Okay, you're saying, well, there's probably nothing there. But when the null hypothesis was false, it means that something really was there. So you're failing to see something that is there. So that would be like acquitting a person when you fail to reject the null hypothesis that they're not guilty. You're acquitting the person. So this is kind of a double negative, right? So you're finding the person not guilty. And I say double negative. Trump just said something about double negative that was really funny a couple weeks ago. But anyway, getting back to the point, failing to reject the null hypothesis that a person is not guilty would be finding the person not guilty. So that would be acquitting the person when in fact the null hypothesis was false, they committed the crime. So this would be like an error of impunity. The probability of failing to reject the null hypothesis when in fact the null hypothesis was false would be equal to a rate called beta, which again is a decimal value less than 1. And this is also the false negative rate. So it's the exact opposite of a type 1 error. So it would be the rate, again, if we're using a screening test, it would be the probability of a test coming back HIV negative when in fact the person was HIV positive. That would be a type 2 error. So you have type 1 error and type 2 error. Type 1 error is seeing something that's not there. Type 2 error is failing to see something that is there. Okay, and this is just kind of showing you it kind of goes back to our 2 by 2 tables that we see in epidemiology, but your conclusion versus the truth. So here are 2 ways you can get it wrong. Your type 1 error is when you see something significant when nothing is there. That's your type 1 error. Probability of a type 1 error is equal to alpha. Remember, our alpha value we use a lot, and your alpha value is just your probability of a false positive or a type 1 error. And the lower you set that alpha value, the more statistically valuable your results are, because it shows that that test was less likely to give you a false positive. And that's why we like to set a low alpha if we can. Problem if you set a low alpha is it's harder to get statistically significant results because you're setting your threshold so high. And then remember that the probability of a type 2 error is equal to beta. We don't use beta so much, we use 1 minus beta. And this 1 minus beta is something called power. So the probability of getting a significant result is your power. And that's an important value. And so if you have a really low power of your test, it's less of a valuable test that you're doing. So I'm not going to go into power here, but if you want to look up what power is, it's really just the inverse of the probability of obtaining a type 2 error. And so higher power, the better. And you can increase power by increasing your sample size or by increasing the precision of your measurement. That's all I'm going to go into on power there. Okay, so statistical significance. And this is where we get into the p-value. So the p-value is the probability when or if the null value were true that the sample mean would be more extreme than the actual observed results. Oh, that sounds so complicated, doesn't it? Well, let me give it to you a little bit less accurate but easier terms that should be sufficient for the USMLE. So the p-value is basically the evidence against a null hypothesis. And the smaller the p-value, the stronger the evidence is against the null hypothesis. So if you have a really small p-value, then it's stronger and stronger evidence against that null hypothesis. So the smaller your p-value is, the more evidence you have to reject the null hypothesis. What is the p-value not? The p-value is not the probability that the null hypothesis is true, and the p-value is not the probability that the observed results were due to chance. The p-value is the probability of repeating the results if the null hypothesis were in fact true. So the smaller the p-value, the more statistically significant your results were. If you have a low probability of repeating the same results you got, which were statistically significant, or let me put it this way, if you have a low probability of repeating the results that you got, then that makes them more statistically significant, because it means that they're more valuable. Okay, so it's really just the evidence against a null hypothesis. That's how I would describe it to you. You can put a number on a p-value, obviously, but I wouldn't worry about that too much for the USMLE. What I would remember is that the lower the p-value is, the stronger the evidence is against the null hypothesis. And like I said, we can determine the p-value based on the test statistic and the appropriate table. So what are some numbers you should remember? I would just remember 0.05. So by convention, if p is greater than 0.05, then you fail to reject the null hypothesis. If p is less than 0.05, then you reject the null hypothesis. So you may see it referred to as when p is less than 0.05, then the results are significant. If it's greater than 0.05, the results are not significant. And you can also see this, that you can have highly significant, very highly significant. I wouldn't worry about that for the test. So p is less than 0.05, significant. P is greater than 0.05, not significant. That's all I would remember for statistical significance, aside from what p-value is, which is the evidence against the null hypothesis. Smaller the p-value is, stronger the evidence is against the null hypothesis. So how do we determine the p-value? Well, if you are dealing with a normal distribution, all you need to do is look up your test statistic on the z-table, and then from that you can find the probability that a random result would be more extreme than the test statistic, and that probability is the p-value. So I think I have it here. Okay, so let's say that you had a test statistic of negative 1.82. What is your p-value? Very easy. All you need to do, since the area under the curve is given by this value, these values here, well, everything more extreme than that z value is going to be what is encompassed by your p, the area under the curve, the probability of falling under this curve. Remember that this curve is also known as a probability distribution function. So if you had, I can't remember what we said here, negative 1.82. So your probability then would be 0.0344. That would be your p-value if you had a test statistic of negative 1.82. Remember, we talked about how to figure out what your test statistic is if you're working with a normal curve. Okay, so that's how you find the p-value for a normal curve. Very easy. Well, what about if you're doing a student t-distribution? Well, remember that was a little bit more complicated. You have to determine your degrees of freedom, which is, remember, your sample size minus 1. And then from there, you look up this test statistic on the t-table at the appropriate degree of freedom, and then you find the probability that a random result would be more extreme than test statistic. So it's just a little bit more complicated in that you have to determine degrees of freedom. So how would you do it here? Well, you would find your degrees of freedom, and then you'd use your appropriate test statistic, and then you would, so let's say that you have a test statistic of 2.3, and you have a sample size of 9. So here's 9, we have degrees of freedom 8 because it's n minus 1. And then you go and you find, or at least approximate, your test statistic, and then you go up there. So if it was 2.3, well, that's pretty close to 2.3060. And so you would have a one-tail alpha of 0.025 or a two-tail alpha of 0.05. So depending on what test you're using. All right. So now, do you want to use a one-tail test or two-tail test? We talked about the tails. We talked about the t-test, and really what it comes down to is whether you want to prove that if you're really only looking on one side, whether something, so if you're looking at blood pressure, whether a drug lowers your blood pressure. If you're assuming that it doesn't raise blood pressure, then you just look on one side. But most of the time, you're going to use the two-tail test because we assume that with any kind of change, it could go in either direction. So a two-tail test is useful for that. And remember for that, though, anytime you're looking at area underneath a curve, when you take your alpha value, you have to divide it by 2 because it's got to be the total area underneath the curve equaling alpha. So if we're looking on two sides here, we have to have a smaller area underneath the curve. It's got to be half. And remember that you're going to have the same value on either side because it's symmetric. Okay, pretty low yield here. So let's do an example, and this might make it a little bit easier for you to conceptualize. So a drug is being tested for efficacy in reducing infarct size in patients who have had an MI. Suppose we know that in untreated MI patients, the mean infarct size is 25, and this size here is done by a very advanced method. Don't worry about the units. So it's 25. In 8 patients treated with the experimental drug, the mean infarct size was found to be 16 with a standard deviation of 10. Is the drug effective in reducing infarct size? Now, I don't want you to worry about going through the equations for this. This would be the domain of an advanced biostatistics course, but not for the USMLE. What I want you to watch here as I go through this is how these values are important and what they mean conceptually. So is it effective? So when we determine whether something's going to be effective or not, what we need to do first is determine what's our null hypothesis and what's our alternative hypothesis. So our null hypothesis is that the mean is going to be the same as the population mean, so 25. Our alternative hypothesis is that the infarcts are going to be smaller, so it's going to be less than 25. Now, we're going to use, for this one, it would be okay to use a one-tail test because we're assuming that it's only going to cause the infarct to get smaller. So you can use the one-tail test. You could use a two-tail test. It really doesn't matter. All it's going to do is change your alpha values. So as we're going through this, the very first step is always to find your test statistic. And your test statistic is equal to, that should be an x bar, but x bar minus mu over S over the square root of your sample size. Now we would use t here because we only have a standard deviation for our sample and we have a small sample size. So we're using t. And so to find our value for t, we use this equation and it works out to be negative 2.55. So what do we do with this? Well, what we do with this is we determine, well, what were our degrees of freedom? Well, our degrees of freedom is going to be 7 because we have 8 patients, our sample size of 8, and so we have a degree of freedom of 7. Now, when we determine if something is effective, we, by convention, use an alpha of 0.05. So what would we use here? So we would use degrees of freedom 7, and we would use an alpha of 0.05. That's what we would be looking for. So where does our value fall here? Well, our value was negative 2.55, but on the, I wish I would have came up with a better example for you, but this is symmetric. So you could use the same, if you're looking for the probability of t based on degrees of freedom is less than your test statistic, you could also do that, and this should be greater. You can also look at the probability of t being greater than a positive value. So I did put it down here. Okay, so the probability of t being less than your test statistic is the same as probability of t being greater than the positive value because it's symmetric. So what you're doing here is you're looking at your sample size, you're subtracting 1 to find degrees of freedom, and then you're looking at where your test statistic falls on that line here. And so as you can see, 2.55 would be right in between these two. And since we're using a one-tail alpha, it's going to be between 0.025 and 0.01. If you're using your two-tail alpha, it would be between 0.05 and 0.02. So here we find that P is in between 0.01 and 0.025. Would that be statistically significant? Yes, because remember, anything below 0.05 is statistically significant. And this, if you were, you definitely would not need to know this for the USMLE, but if you were to put this into Excel, for instance, this would be useful for you if you were to do clinical research. You'd find that, in fact, you have a p-value of 0.019, which is less than 0.05, but certainly if you were to be given this on the test for whatever reason, this would be as far as you would need to know it, and I think this would be way beyond the scope of the test. But I'm just giving it to you so you kind of have an idea of how these fit together. But that's how you would find your p-value. You would approximate it between 0.025 and 0.01. Okay. So like I said, if you go about and look on YouTube, you can find other people's videos that go in greater detail in statistics if you're really interested in this stuff. But I really talk about all the stuff you need to know for the USMLE. If you know this stuff that I've gone over in this video, you know probably more than you need to know for the test. But yeah, so there's your 0.019, and yes, the evidence from this sample supports the hypothesis that the drug is effective. And that's all I got. If you have any questions, please write me a note. I would not agonize yourself over the details. Just know type 1 versus type 2 error, know what a p-value means, and know that if it's less than 0.05, it's statistically significant. If you know that, you're going to get most of your questions right on hypothesis testing. I will see you next time.